Good morning, Pre-Health Sharks. It is time for another edition of our Wake Up Pre-Health Sharks webinar. And today we have a very exciting topic, to be or not to be, exploring your gap year options. I'm Emilio Lorenzo. I'm the Associate Director of Employee Relations. And I'm going to let our other two experts introduce themselves, and we're going to jump into our topic for the day.
Hi everyone, my name is Gabby Gross and I am a career advisor for experiential education in the Office of Career Development.
And hello everybody, my name is Daniela Caracas-Suarez. I'm also a career advisor in career development, and we're excited to have you here today.
So we have some great things to provide you today in terms of insights on exploring gap year options, to be or not to be. This is usually a topic that around this time of year people are thinking about if they should jump into graduate school, jump into the workforce, or take a gap year before going into some of those professional programs like medical school, dental school, pharmacy. There's a lot of benefits and there's some cons to it. There's a lot of experiences you can do, and so we're going to be diving into all of those different pieces. But before we get too deep into it, I think a good starting point is, what is a gap year? And so obviously it's a break in time after your graduation that you're building yourself up to go into the next step. So it's almost like a lily pad to going from one thing to another. And there's a lot of things you could do in that year that we're going to be talking about to not go too much. But Gabby, do you guys have some insights on how you would maybe define a gap year?
Yeah, so I would say it's an intentional period of time for a student to gain more experience. And I like to always say that in a positive tone because I feel like gap years are also looked at in a very negative tone, which I think Danny's going to go into a little bit too. But I want this also presentation to be a way for students to see how this is an opportunity for them to only strengthen any application that they are going towards.
Absolutely. Intentional and strategic, I think, is taking that time off.
Mm-hmm. Definitely. And I would also add it's a great time to recharge and get that motivation that you need again before going to grad school or professional school. So I know that, you know, build up for excitement to go back into schooling can be a big piece to gap years too.
Exactly. Intentional, strategic, chance to build you up, chance to rejuvenate yourself. All things that I think are going to fall under our benefits portion of the presentation today. But yeah, gap year is very common, you know, so then give you a chance that after your 4 years of college, that you get a little bit of a break before going into our next program or the next step in your career. So what that entails, what it's all about, that's what we're going to be talking about today. I think the first thing we're going to tackle is this right for you, to be or not to be? You know, gap years aren't for everyone. And you need to really evaluate if it's the best choice for you and what you're going to be doing in that year. So we're going to be talking about the pros and cons and evaluating and how you should take steps to evaluate if a gap year is a good option for you based on your goals. That includes evaluating your application to medical school or professional school. So looking at, you know, if a gap year is going to be more beneficial for you, or you should be going straight into the application itself. And also evaluating to determine what are areas you can improve on your application using that gap year strategically. I already mentioned we're going to talk about those pros and cons. We're then going to go into the types of experiences you should be evaluating and looking for during your gap year. Goal setting. We're going to talk a little bit about how to set realistic and strategic goals during that gap year. And then explaining gap year to your family. I think this is probably one of the more difficult portions, is not just planning your gap year, but especially if you have parents that, you know, are really on top of you about your goals or really invested in your future, they're going to have questions on why you're taking this time off. And I think we're going to be able to go into why you can, or how you can strategically talk to them. It's not just a year off, it's a way that's going to enhance your career. So we're going to jump into that and then finally give you a lot of resources available to you as NSU students and alumni that can really help you not only evaluate a gap year, but you know, take advantage of all these experiences that we're going to be talking about. So I'll turn it over to one of our experts to going into if evaluating a gap year is right for you.
Thank you, Emilio. So this goes back to what Emilio was saying about the to be or not to be with gap year, it takes a lot of really evaluating what's really right for you after graduating. So one is really knowing your career goals. Maybe evaluating, is professional or grad school needed for you in order to be pursuing a professional career? Or can you really realistically go into a career like public health or epidemiology, starting out maybe in some sort of entry-level career, knowing what your field is requiring, and if you need to go into that professional school right away, or maybe if you can take that year to really evaluate everything that you need to really feel prepared. And then the second point we have here is being able to articulate the why behind your goals, because without a doubt, going into these professional and grad school interviews, they're going to ask you, why are you interested in this school? Why are you interested in this career path, and what motivates you? And ideally, you would have some answers that go beyond just, you know, your family motivated you to go into this career, your family, they're, you know, all working in healthcare. You want to really showcase to them the experiences that you've been able to build, and that you've really solidified that why on why you want to go into this profession. Like Amelia was saying in that previous slide, you want to evaluate your application standings and really see how competitive you are when applying to some of these programs. So we've talked previously about those 5 pillars of pre-health. Have you worked on your academics, gaining that healthcare experience with shadowing, internship opportunities, volunteering around locally, or doing those mission or medical trips around the country or beyond? Doing all these different opportunities to really make your application stand out as strong as possible. That can help you determine if maybe you need that gap year to build some of those experiences and become that stronger application that you really want to be. It helps to also discuss some of these options with your mentors, advisors, family members. And although we will talk about how to discuss a gap year with family, it could help to start already having that conversation to see what they think about, you know, how ready you might be or feel for the opportunity going into professional school. And then talking to maybe some STEM professors that you already have now and seeing what they feel like might be the right option too. One of the most important things to go into the gap year is starting out with that game plan too. So really you want to be strategic about what you're doing going into this, if it's something that you realistically want to do, because especially if it is going to be an extra year you spend before going into med school or PT school, you really want to make the best use out of it, so that when they ask you inevitably, why did you take this year off, or what did you do during this gap year, you really show them something valuable that you thought about and really wanted to gain that experience for. And then like Gabby was saying earlier too, sometimes a gap year can have a negative connotation. So not being afraid of a gap year too, because a gap year can really be something positive when applying to these programs. They can see you really took the time to understand yourself and understand the rigor of the field and gain that healthcare experience. So it can really honestly be one of the best things you can have in an application, especially if you plan it out and do it right. And lastly, we'll be going into some of the pros and cons to deciding if a gap year is right for you, which we'll go into the next slide.
Some really good points, Danny. And I think starting off with being able to articulate the why, you know, if someone asks you, why do you want to be a doctor? And the only answer you have is to help others, there's a lot of ways to help others. Us as career advisors, career coaches, we all help people. Why is it in the context of healthcare and where you're going into that you want to help people? And if you can't articulate that, that's a good why for a gap year, because you need to then immerse yourself more into the field. It's great that you were a bio major, a public health major, but if you haven't gotten those realistic experiences to see it for yourself, it's going to be hard to sell an admissions committee as to your fit. And what Danny mentioned about evaluating those 5 pillars, from academics to research to community work to even healthcare experiences, those things need to be built up. And you don't want to waste applying knowing that your application is weak, instead of really taking the time to pursue that gap year. So doing this early on can be very helpful, and something you could do with our advisors is really taking a look at those 5 pillars and being realistic and having someone in your corner that can also give you feedback on where do you stand on each of these pillars, whether your GPA is low, whether you don't have those right experiences, or going back to what I mentioned, not being able to articulate the whys because you're lacking the experiences that can confirm that interest or that passion for this area.
Yes, great points. Thanks, Emilio.
All right, let's go into some pros.
Okay, so thinking about the pros of a gap year. So one, even thinking about just those professional exams, the GRE, the MCAT, you have a lot more time to study for it and really feel as prepared as possible. because that's part of the academic pillar of being that pre-health applicant, where you feel strong in submitting a good GPA, MCAT score, and being as strong of an applicant as possible. Another piece that's a pro to having a gap year is that you have more time and more opportunities for those extracurricular enhancements. So maybe you didn't have enough time to do as much volunteering or shadowing or research as you would have liked to do, because you were balancing a lot of your classes during your undergrad time too, or maybe a full-time job to support yourself. This could be the time for you to be able to do some of those things that can really amplify your application and get you to even realize what your real why and passion areas are within healthcare. You can gain some competitive work experience. So I know some students, they may gain their first experience right out of undergrad during their gap year working in a clinic or working in a hospital, doing something like being a patient access representative and getting that face-to-face time with patients and getting that bedside manner so they can be as competitive as possible and see if the healthcare setting is one that they feel really comfortable in. Another is just even preventing burnout. Like we were saying earlier, it's a time to really recharge too, because 15, 16 years of schooling all the way through since your childhood can be a lot for a lot of students. So taking that time to step back and recharge can give you that momentum to go back in really motivated into med school, professional school, whatever it may be. And it could actually make you more prepared and better in your academics just going in with that little bit of time to recharge. You can experience the real world by doing those things like we mentioned, getting that involvement in a hospital, in a clinic, and getting that work experience you need. And there's fewer distractions because, being an undergraduate student, there's a lot of things that you're balancing along with your classes, probably your organizations, maybe being an RA, orientation leader. So without some of those distractions, you can really focus solely on gaining those healthcare research experiences that you really do want to build. You can increase that medical knowledge and just being comfortable within the healthcare industry as well. I know Gabby's going to go into some examples like maybe scribing, where you can really follow around a physician and gain that medical terminology that can make you really competitive. And lastly, it gives you some time to save up for professional school too. So financially, it can give you time if you want to work full time for a year. You can start building up financially and feel a lot more prepared and secure going into that program. So there's a good amount of pros to think about when evaluating if gap year is a good option for you.
Yeah, experience in the real world to me is very important, especially if that real world comes with healthcare experience, because you're going to feel a lot more confident. I think one of the things I've heard from first year medical students, dental students onwards, is that uncomfortableness of working with patients or being in a healthcare setting. It takes time to adjust. And not to say that by doing this, you're going to feel completely comfortable, but you're going to be ahead of the game a little bit. And it's definitely going to give you an edge going in there, where you're going to be in a setting thrown into the fire a little bit, and having these experiences and having that ability to balance your work. Or I know we're going to talk about some rigorous academic programs. It's really setting you up for the mindset that you need in a professional program. Because as challenging as you think undergraduate is, no matter what you've taken, no matter what you've done, it's not going to compare to those professional school challenges and the rigors involved in that.
Absolutely.
Definitely, Milan. I wanted to touch on one
please.
more thing. Sorry about that.
No,
I don't know the exact statistic, but I do know that the average age of these professional programs, are in their late 20s, students in late 20s. Am I right?
I believe so. I don't have the stats in front of me, but I do know that a lot of students, especially like dental students, dental is a very common place to take a gap year. I know I've had family that have gone to dental school, and majority of people that were in their classes had a master's degree, took a gap year, gained experience, whether domestically or abroad. It is very normal for people to go in there and already have had some experiences under their belt. But I think you're right. I think majority of them it's not like mid 20s to not late 20s.
Yeah, I just wanted to bring that up just because I feel like a lot of students do think, talking about the pros like we are, think like, oh, I have to go straight just because, I'm running out of time almost. I think students, think there's like a timeline, but it's very normal, as you're saying, for students to take these gap years to become more comfortable, become just better applicants moving forward.
Yeah. And not being afraid. I mean, what's another year going to affect the the long career track you have, because becoming a doctor is a long process. It's not just 4 years of medical school. You then have residency, you have fellowships. There's a lot of things that come into it. And so if you're not ready mentally for that, it's going to feel like a big burden, and it's going to be hard to see that light at the end of the tunnel. And again, it goes back to that confidence of being able to be successful there. Obviously, some other healthcare options like dental school are shorter career routes, but those definitely involve patient exposure earlier on in your program. And so, again, there's a lot of pros in being able to take that gap year to feel prepared and feel confident going into that. But on the other side of the coin, the cons of gap year.
Yeah, and you all sort of touched on even the first few pieces of some of the cons of gap year. And one is a lot of that timeline that students kind of put on themselves too. Especially I feel like students that we do see at NSU who maybe like dual admit students, the 3+4, for example, wanting to graduate early and go straight into medical school. So for other students who are considering a gap year, I can see why one of those cons might be seeing that longer career track and feeling like you may be either falling behind, or you may not, be following that timeline you may have set for yourself all your life. So really keeping track of yourself and knowing when you want that gap year to really, that deadline to end and start professional school can help you in determining if that longer career track is something you'd like, because definitely setting aside a year to gain extra professional experience will have you feel like you may be a year behind some of the other people you may have graduated with. So it's something to consider. Another thing is a con could be if you don't use your gap year strategically. So that's why planning out that gap year beforehand, especially with somebody like your Excel career advisor, could be really important, because you want to take the most advantage of gaining those experiences and making yourself as strong of an applicant like we've been talking about as possible. Because although we'd like to take that extra year to recharge and binge watch a lot of Parks and Recreation, you also want to balance that with time to start shadowing and gain that healthcare experience too, that is going to make you that strong applicant. So that way it doesn't extend your career track a little bit longer. That readjustment to student life can also be a bit of a difficulty if you do decide to take a gap year. Like I was saying earlier, it's 16 years that you've been in school. So some might say you already have that momentum to go straight into med school too. So it's thinking about what's the right path for you, whether you feel like maybe that readjustment may get you to, it might be a little bit difficult for you to come back and get in that groove of doing classes and balancing life again. So seeing what might be the best path for you. Another thing to think about is that rejection after a gap year could set you back again. So that's why really being strategic and planning out that gap year to make yourself competitive is going to be really important, so that you don't feel like you have to get that rejection, or you can think about what extra pieces you can do to make yourself even more competitive next time. Another piece that happens to students, especially those who end up working full-time, is that they get really attached to their full-time job, and they might get attached to also getting paid full-time salaries for the first time, which is not necessarily a bad thing. Maybe you realize a different career path is the right trajectory for you, but it could be something to consider, that it might offset that career idea or dream you've had your entire life. So knowing either, like, let's say you're scribing, knowing if there's definitely going to be an end date to that, or if that's something you want to continue indefinitely. It does happen to students where they do get very attached or comfortable with a certain lifestyle once they start working full-time. And the last piece is cost factor, especially for students who do decide to do a gap year abroad, either doing a mission trip, studying, doing research. That can end up costing you a lot financially. So whereas some students decide to take the gap year to save a lot by working full-time, some students end up spending a lot. So considering what might be the right track for you. And there's a quote here that we enjoy, having a detailed plan can be the difference between a successful and an unsuccessful gap year. So really plan it out ahead of time and know what all of your options are. And I know Gabby's gonna dive a little bit deeper into what some of those ideas may be for you.
Yeah, some really good things to really consider. So don't just think about the pros. I know we're talking about evaluating gap year, because you really need to think of the good and the bad that comes with it, because it's not for everyone. And thank you, Scar, for mentioning rejection is probably the scariest con. Yeah, because imagine you take that gap year, you go and apply again, and then you get rejected again. And then it's like, a down to earth moment. Where do I go from here? And obviously there's plenty of options to go from there, but that's why it's so important. You notice that the first step, or the first slides we had, wasn't about the experiences you can have. We talked about evaluating yourself. evaluating the application. So that way, when you do take a gap year, you know the points to hit that's going to put you in a position to get into your program. That even could come with talking to admissions counselors and others in that program to ensure you know what are the requirements, what are the things I need to do to put myself in that position. Because every gap year could look differently, and I know we're going to dive into that. But you really need to make sure that if you are taking one, it's being done in a manner that's going to put you not in that position where you're worrying about rejection. You're going to be more evaluating your options on which program's the best for you. But some of the things that Danny mentioned are also things that could happen, adjusting to student life and growing too attached to your job. These are just common things that we see with people that take that gap year. Sometimes it's hard to go back from the real world into the student world, so the goals you have. And so keeping that, I always say, don't lose track of your yellow brick road. And a lot of things that we're going to be talking about is making sure that you're on that path to the yellow brick road. I guess medical school is in this analogy.
I love that. So cute. All right.
And let me just, there we go. Perfect. Yeah. You're up on what you should think about accomplishing during your gap year.
Yeah. So thank you, Danny and Emilio, for bringing up such good information so far. I think having that detailed plan is so important. That's the one question I get from students is, you know, okay, I'm going to decide to take a gap year, but really, what do I do during that time? And I suggest not to just sit on your butt and do nothing. You know, you do have to get up, do things that are really going to improve your chances of getting into any program that you're wanting to do. So I want to just give an overview on this slide of a couple of options, then we're going to go into more specifics. The first is really those numbers. I always say this, that medical schools and a lot of other programs, PA, PT, dentistry, whichever, they're always looking at your numbers first. So what that means are your grades and then those test scores that you need. So really fulfilling those prereqs, any classes that you're needing during this gap year that you may have missed, strengthening your GPA, and we can talk, we're going to go more into that, but with programs such as completing master's degree programs or post-bac programs, and just improving like your overall application as a whole, and filling any of those gaps. And then also studying for and taking MCAT exams, GREs, like Danny said, any, really tests that you need for the program that you are applying to. Because sometimes when you're in undergrad, there's just really, I guess, a strict timeline that you have to study for your classes as well as studying for the exams. And sometimes it can get overwhelming to do all of that at the same time. And then continuing just to gain experience to strengthen that application. So like we were saying, real life work experiences is so important. And yes, this can go as a con. I think, like you said, Danny, that people get adjusted to getting that salary and being comfortable in their job, but it also can be a really big pro because, these programs do like to see students working full time, gaining that real life experience, whether it is related, like I have here in the medical field, which is super important, we'll go into, but also it could be outside of the medical field. Let's say you're just working full time as a server or at a store. It really doesn't matter as long as you're gaining those experiences that you need or skills that you need to transcend over. And then as well, we talked about in the last slide, just making money straight up. Making money is important and it's going to be helpful for paying for any of these programs that you are interested in. And then just developing key skills and knowledge, filling those gaps that you may have missing. And then most importantly, taking time to reflect and rejuvenate. This gap year, yes, will entail you doing some hard work, whether it's through a program or through gaining experiences, but you also have to reflect. The last 3-4 years of undergrad are just a lot. And I think like Amelia was saying, it's a totally different ballgame when you get into med school or if you get into any of these programs. So taking this year to just chill, as I like to say, and become prepared for what's to come.
Yeah.
But we'll go into just more specifics in the next slides.
Yeah, a lot of good points Gabby mentioned. I think doing some goal mapping where you have these overall goals and then underneath each of these goals that you set for yourself, what are the experiences? What are your resources? Who do you have to leverage? And we're going to be talking about these experiences, but I think seeing these overall points takes it from like the big umbrella. And now we're going to be talking about what are the individual umbrellas under each of these goals.
Yes. So I like to split this up almost into two parts. When a student asks me, what should I do during a gap year? I mean, for us as an advisor, and I'm sure Amelia and Dana, you guys would agree, we like to view the student as a whole and see really what they're missing within an application, what they need to strengthen. And I like to separate into two parts. The first being maybe that they're missing the experience, so we'll talk about that, or maybe they're needing to increase academics or test scores. So going into more experience, there's so many things that a student can do. It really just depends on what they're missing and maybe what they themselves want to gain experience on before feeling comfortable. So that's volunteering in a medical related field, hospitals, clinic. We tell undergrads this all the time. Continuing to gain that volunteering experience looks really great and adding up those hours. Pursuing any type of professional medical experience. I think, like you mentioned, Amelia, working as a scribe is a great option. Scribe America has tons of opportunities. Doing, EMT or becoming a medical assistant. I know it's a bit down on the slide too, gaining those trainings and certifications. I'll just go into that now to strengthen, your CV, your resume. Any experiences you can add are going to be really beneficial. And that also just helps you to gain real world experience. Being an EMT, being in the ambulance, like that is just so cool, number one, and also helps you to gain that direct patient care, which is what a lot of these programs are looking for. In addition, just shadowing, shadowing is always beneficial. We always bring this up to students. So shadowing physicians or any other type of healthcare professional that you are wanting to gain exposure to. Participating in research looks really great. So doing, research, whether it's staying in contact with a faculty member at NSU or any other area or type of program you can do during your gap year would be great. Any other type of scholarly activity, and that's something that we can definitely as advisors speak to you about if we feel like it's a good opportunity for you to do or not. It really just depends on what it is. Again, those trainings and certifications, really, really important for a student to do. It's just making yourself better. It just goes back to that, like this gap year, the point of it is just to help you increase your chances personally and professionally. And I think gaining any type of certification or training is always better. Studying abroad, I know we spoke about this earlier, Emilio, too. Doing something abroad, gaining that global outreach for yourself always looks great. And then mission trips kind of goes with that too. So doing a mission trip, service, the world needs help. And I think looking towards that, especially now, we can see that just looks good for a student, and it helps like heal the soul too as a student. As a healthcare professional wanting to go into this really helps you to confirm this is something that you want. But those are just some options in terms of experiences. And if you feel like that you as a student need to fill the gaps for this, like you may have a decent GPA, you're at a good spot with your MCAT, good spot with your GRE, good spot with the ZAT, but you feel like those experiences are missing, these are just some options.
Yeah. And some of these mission trips are even specific to medicine. And the great thing about it is when you leave the US and you go abroad, a lot of the abilities you have in terms of exposure to medicine increase just because of the laws and rules are a lot different. And so if you're looking for a much more intensive hands-on experiences, there's a lot of organizations that provide medical mission trips that partner you with doctors, nurses, other healthcare professionals. And it really, not just a bird's eye view of medicine, it really gives you a hands-on where you're doing actual work on patients, you're interacting with patients, something that doesn't come in a lot of different settings.
Mm-hmm. Yes, a direct patient care is so vital. And if you can take time to do that, your application will soar.
But I think all of these points, and again, you might need a combination of some of these things, just one of these things. But I think it goes back again to evaluating your application, evaluating where you stand, and thinking about what are all these things that are going to enhance and really showcase that I've taken advantage of my gap year and I've put myself and my application in a position where it is competitive.
Yes, exactly. All right, so going into that second part I spoke about before, I like to split this up into two parts. The first being experience, the second being really those numbers. So academic programs or those studies that you need. I think it's really hard sometimes for a student to gain experience and study at the same time. Like especially in undergrad, sometimes it gets very overwhelming, and a student might either fall behind in their grades, or maybe they didn't have enough time to study, for everything that they needed to, because they were very focused on getting those experiences. So it's hard to juggle everything. So if you feel like you're a student that may needs to enhance their academics, there are options for you in the gap year. The first being a post-bac program. So this is a post-baccalaureate program. I like to refer to it as more of a bridge program for students to, take those additional classes that they might need or retake classes that they might have done poorly in. And a lot of schools offer this. I know NSU, offers a post-bac program specifically for students to just get used to the rigors of medical school, and it's a perfect bridge into a medical program. I always like to suggest students to do a post-bac program at the institution that they're wanting to go to school at. So let's say they're wanting to go to medical school at NSU, doing a bridge program at NSU, let's say it's another school, doing a bridge program there. That way they can get used to like the faculty, staff, just everything that's going on at that institution. But on the flip side, you can also do a master's degree. So a master's degree looks different than a post-bac because a master's, you're actually getting a degree. It's a separate degree that you can have in an area of study, whether it's public health, biological sciences, nutrition. These are just some examples. And there's master's programs, of course, all over, the world in different institutions. And I know, Emilio, you spoke about those special master's programs. Do you mind touching on that real quick?
Yeah, absolutely. So as Gabby mentioned, post-bac programs, great bridge program. But a lot of times those bridge programs, it's not a degree that can stand on its own, unlike a master's in biological science, master's in public health, master's in nutrition, where if you decided to use those degrees, whether now or even within combination with your medical degree, it only enhances your career options. You can work at a global scale, you can work in public health. And considering what's happening with COVID-19, there's a lot of things that you could do with a public health degree. A specialized master's program is a little bit different. It's a lot more intensive. It's very much hands-on, and it's a specialized program. Usually they ask for a higher GPA. It's usually tied to the medical program. You'd see NSU's program is tied to one of our medical schools. Gives you very hands-on experiences, research. It's just very competitive. It looks really great coming from that and applying to a professional program, just because the application process for that is very competitive in itself. So it's going to make you feel very confident, but it's also going to look very strong in your application just because the experience is tied to it and the fact that some of it is being taught by actual medical school faculty.
Perfect. Thanks, Emilio. And I know you even touched on how, members of your family were in pre-health or healthcare programs, and they saw that a lot of their fellow classmates had masters and had these post-bac programs. So it's super common for a student to, evaluate with themselves and with the career advisor and say, hey, I think that I'm missing some, of those academic pieces in order to get into the program that I need. So considering a post-bac or a master's is always positive. Considering the length of time for that program, it gives you, I think there's pros and cons to this, but I think it gives you time to gain more exposure, to gain just so many different skills. I find it as a plus personally. I know that students sometimes think of it as a con, but it only is helpful, I feel, because really just more on those benefits, it helps you to enhance your knowledge base, taking more classes, gain more of that knowledge that you need that you maybe didn't get in undergrad, learning new skills for future goals, and maybe you even learn a new skill that you weren't expecting, and then gaining exposure to rigorous academics. Emilio, you touch on this too. I think you say it all the time. Undergrad and med school or dental school, whatever program, are two different ballgames. I think students sometimes don't see that it's going to be a little, probably more rigorous than what they're used to in undergrad. So these academic programs can really help them gain exposure to the rigors and get comfortable with it before going in.
Absolutely. Like the expectations that faculty are going to put on you as a master's student is going to be very high. It's going to be very similar to when you go into a professional program. And so getting that mindset, because it's different, there's not going to be as much hand-holding. There's going to be higher expectations. And guess what? The people around you, even if you were top in your class in undergrad, you're around a lot of people that were also top in their class. And so the challenges and the competitiveness of that, and the expectations is really kind of prepares you for the mindset and the study habits and the approaches you need to be successful in a professional program, which is going to be at a higher level than when you were in an undergrad.
Exactly. And I do want to touch on, that I said that you can use a gap year to gain experience or, to enhance academically. I think you can use a gap year, obviously, for other things. If it's just hanging out and you needing that time to like recharge, you can of course do that. We just feel like in career that it's better to use this gap year intentionally and doing things to just increase. But I have heard of students just taking that time maybe to travel or things like that for their own personal growth. So I did want to touch on that.
Yeah. And whatever you do, just know you will be asked about it. So if you do take a gap, you're going to be asked, so what did you do? And so you want to, obviously traveling, obviously doing academic programs. But I think as Danny mentioned earlier, it's like, you don't want to say, well, I watched a lot of Parks and Recreation trivia that they bring my way. And so you want to be much more intentional and strategic, but there's a lot of things that you can explain on how you took advantage of that gap year.
Mhm.
Perfect transition into explaining your gap year. So I think one of the biggest questions as advisors, career professionals we get is, it's great. I want to take this gap year. I know the benefits of it. I understand it's going to improve my application. How do I tell this to my parents who are paying for my college education? I live under their roof maybe. There's a lot of expectations. There's a lot of goal setting. I feel a lot of pressure. I don't even know how to broach the subject with them. I think the biggest thing is before you even sit down with them and talk to them, don't bring it up until you're certain. Don't bring it up until you've thought it through. Don't bring it up until you've really evaluated on where your application is lacking and the pros of why that gap year is going to enhance it. And then also knowing that you have a plan in place so that your parents understand, wow, okay, I'm understanding why you need this and how you're going to take advantage of this. So once you have that plan in place, you've evaluated, you know everything, then sit down with your parents and family and clearly explain it to them. Let them know why this is going to be beneficial for you. Explain to them the why. I think we start off the presentation of explaining the why you're passionate about it. Explain that same why to them. Why you're passionate about this field, why you want this, and why this gap year is only going to enhance it, not take it down a notch. Even hitting on like, look, I'm going to be able to use this master's degree. I know plenty of professionals who are doctors and they also have a master's in public health, or doctors and they also have a master's in nutrition. And maybe they might be practicing physicians, but they might have side business, nutrition opportunities, or doing global impact. Maybe you want to go back to your home country and start a nutrition program or start health initiatives. There's a lot of ways that you can show the value of this gap year. Or going back to the bare bones of telling your parents, hey, here are the requirements for the schools that I want to go to, that I know you want me to go to. Here's where I currently stand. For better or worse, this is where my GPA is. This is the experiences I gained. And if there's some disappointment on why didn't, sometimes parents are going to be like, well, why didn't you do more? Help them understand, walk them, like they can't walk in your shoes. They don't know what you've done. They don't know how to balance how you balance your workload. Help them understand these things. Help them see it from your life. But don't get frustrated. If you start being like frustrated with them, they're going to get frustrated back with you. Clearly explain it. Imagine you're trying to pitch it to them. If you need visuals, even I've heard students having a PowerPoint that they show their parents. Whatever it works to kind of help them understand it from your perspective. And really focus on the benefits, how it's going to improve it, how it's going to enhance your career as a whole, not just these next 4 years. And I think it's helping parents understand because they think, okay, college, grad school. But help them understand it's not just these next 4 years. It's like way beyond that. Even talking about starting your own family and all these other things that come into being more strategic. Explain in detail your gap year options, what you're going to do, what you've talked to your career advisor about, what applications you're going to put in. Almost help them see that, all right, this is where your application lacked and how this next year is going to enhance it. Show that career trajectory, how it's still going to keep you on that same course. It might only delay it a year or two. But I think it's really helping them see it from your perspective and helping them understand that you do see it from their perspective, that you understand their concerns, but you're helping mediate their concerns by having that game plan, by having those strategies. And again, if they're still frustrated, I think, or you're worried about even broaching this conversation, just know at the end of the day, it's your journey. Your parents are obviously a huge support network. They might even be the ones funding your education. But at the end of the day, it's your journey. You're the one that's going to have to work with parents. You're the one we're going to have to work with patients. You're the one that's going to have to put in all the work and really walk through the hardship that comes with a program like this. And so at the end of the day, you got to feel comfortable, and helping them understand that is going to be a key approach. And again, be calm, be articulate, have a plan in place, and really understand it from their perspective so that you can hit on some of the things that are the biggest concerns. Guys, did you have anything else that maybe I'm missing in that?
Oh, so I mean, I love this slide and everything you've said, especially for my students who are first generation and maybe come from families who have never even heard of the gap year concept before. So I feel like, especially what you were talking about before, like some of your students have even prepared PowerPoint slides for their parents to really feel like they're in the process with them instead of maybe feeling like they're in the dark. So I think that's the most important piece, is getting your family to understand what it is that you plan on doing, understanding that why, and feeling like they are along this process with you, because I feel like once they know you're confident about your decision, that's what gets them on board with you too.
Absolutely.
I wanted to also add, I think, Danny, you're so right on that. But what I'm saying actually goes perfectly into the next slide, that like we are a support system for you and we can help practice, having that conversation. I'm more than happy to put myself in the role of a mom or dad or grandmother, aunt, whoever you do need to speak to, and really discuss how this may go based on, the student knows their parents best. So speaking about how they feel their parent might react and how we can best set themselves up for success.
Yeah, as advisors, we're going to ask you some of those same tough questions. Well, why are you taking it? And especially if your application is strong, that's going to be even more explanations of, or a strategy of why you need to take this gap year. So some good points there. Now some resources. So there's a lot of things that we can help you. Obviously, we've been talking a lot about career development. We're in your corner. We can have these conversations, not just on planning to talk to your parents about it, but asking yourself the right questions, identifying where your weak points are, and then also evaluating options for what you're going to do in that gap year, putting referrals for you for opportunities in that gap year, connecting with employers, helping you with the application of grad school, all those different pieces. Academic advising, obviously helping you evaluate your GPA, the courses, making sure you're in a position of success. But there's a lot of different resources here. International affairs with study abroad, writing center in terms of those personal statements and applications, professional test prep, Kaplan. There's a lot of resources. Let's say your MCAT is where you're struggling, your DAT. There's a lot of test prep resources, Kaplan or onwards. Leveraging mentors and family who understand who you are, what makes you tick, what you've gone through, can give you guidance and support you need during this time. And faculty, because again, they're in your corner too. They're resources for you. They even might be able to provide those letters of recommendation for those programs. And admissions counselors going to those programs and learning, especially if you applied and got rejected, what was the feedback of your application? Or being able to evaluate for you where ways that you can improve your application as a whole. But these are just some of the resources available to you as NSU students. Is there anything you wanted to chime in on some of these resources or something I may have missed?
I think just like leveraging all of these connections, there's so many people at NSU and outside, to help you as a student if you are struggling with whether you should, take a gap year, what you should do if you do decide to take one. I know, like Emilio said, we talk about it so much in our office. It's like one of my favorite topics, honestly, to talk about. But I think there's so many other people, academic, advising, writing center, Kaplan, I think was a great point as well, because they have so many resources. But it's also just being comfortable maybe with talking with friends or family that know you best, and that maybe can help you make this decision, because it's not a small decision. It is a big decision to make when you are a student.
Great points.
Yeah, and I think knowing too, even if you do decide to take that gap year as an alumni, you can still come back and use these resources too. So we still meet with our alum all the time and do these, continued gap year conversations, planning for that grad or professional school. So, keep using those resources, because you're still family even after you graduate.
Overall tips. Now, I think we've been hitting on these points, but understand your career goals. Don't be afraid to take a gap year, because it could be beneficial for you and it might be the right option, but you got to weigh those pros and cons. start that early. You can't be thinking about this way after graduation. You should be starting this as early as possible. So again, when you have those difficult conversations with parents, it's not happening on graduation day and you're bringing that up. Evaluate all of your options, know what those options are, those timelines, because even for post-bac programs, master's programs, there are deadlines to apply to those, so you can't wait too late. We've talked about knowing your resources and leveraging them, creating a game plan, whether it's with your advisors, mentors, faculty, and again, weighing the pros and cons before you decide. And the biggest point, I think it goes with that fear factor, there's many roads to reach our career goals, not just one. And I think even looking at people that are in these roles that you see yourself in, you're going to see not all of them have the same story, the same approach. And so that should provide you comfort. You shouldn't compare yourself to your friend that you took bio to with or org to. You need to really evaluate it for yourself and what's best for your career track.
Yeah, thank you, Emil, for bringing that up, because I feel like, at NSU and a lot of other institutions, you get bogged down as a student by comparing yourself to others and where your friends are at and where maybe your classmates are at. But this is your journey and it's going to look different. I'm a big believer in you're meant to be where you're meant to be. So if it is choosing a gap year, then being confident with that decision or not, really, it just depends on what helps you to reach your personal goals.
Absolutely. So this was our presentation. We hope you gained a lot from, exploring gap year options to be or not to be. The last thing we'll leave you with is NSU career development. I think we got just cut off right there at the title. That's okay. NSU career. So we can help you out. Career exploration, resume and cover letter, grad school planning, personal statement, taking advantage of this gap year. You can schedule an appointment by going on Handshake. It's the same username and password you use for SharkMail, SharkLink. Or you can call our front desk, 954-262-7201. You can come in for a drop-in, schedule an appointment. But we're here for you, and we're here to make you feel confident with this next steps in your career, and also illuminate the unknown, because we know that unknown is what makes us afraid. But it goes back to, we want to make sure you're on that yellow brick road, and if that leads to that medical school, then great, and we're going to make you in a position for success.
Definitely. And I love the cutoff because it actually says NSU career develop me. So in a way it works out.
Yes, I love that.
So thank you again, guys. This recording will be on our YouTube page, NSU Career Development. And so if you're interested, you can check it out. You can look at all of our other previous webinars. So thank you for listening in, and thank you again for our experts in sharing their insight.
Thank you, everyone. Have a great day.